Hey there, fellow healthcare providers. Are you ready for another deep dive with us today?
Always excited to dive in.
Well, let's jump into a connection that might just change the way you approach patient care.
Sounds intriguing.
We're going to be talking about the link between periodontal disease and cardiovascular health.
Yeah, you mean that whole mouth-heart connection?
That's the one we keep hearing about it more and more.
Yeah, and it's more than just a catchy phrase.
Right.
We're talking about how inflammation in the mouth could actually be like this missing piece of the cardiovascular puzzle.
Oh, that's a great way to put it.
And we've got some compelling research to unpack today.
Absolutely. And to help us unpack it all, we've got a systematic review from Cureus that published just this year in 2023.
Very recent.
Yes, very recent. We also have a 2019 meta-analysis from the journal Vascular Health and Risk Management.
Nice.
And a 2022 article from Oxidative Medicine and Cellular Longevity.
Wow. So we've got quite the lineup of research here.
Yeah, all digging into this fascinating connection.
So where should we start?
Well, I think it's helpful to set the stage first.
Okay, I'm with you.
Periodontal disease, or PD, it affects a staggering number of people worldwide.
It really does.
And we're talking about chronic inflammation that destroys the tissues supporting your teeth.
And the scary part is it's often silent in its early stages.
Silent but deadly, right?
Right.
Because we're learning that it's not just about losing teeth.
Exactly.
These studies suggest a strong association between PD and a whole host of cardiovascular issues, heart attacks, strokes, even hypertension.
It's a pretty big deal, and the big question is why?
Yeah, how can something happening in your mouth impact your heart?
Well, there are two main pathways the research highlights, and the first one is almost like something out of a sci-fi movie.
Oh, really?
It's called transient bacteremia.
Transient bacteremia, that sounds intense.
It is. So imagine this bacteria from your mouth, fueled by poor oral hygiene and inflammation actually entering your bloodstream.
Hold on. Bacteria from my mouth going into my blood. That's unsettling.
I know.
How did that even happen?
No. Well, think about the tissue in your gums. It's incredibly thin and vulnerable,
Okay.
making it easy for these tiny microbes to kind of slip through, especially when there's inflammation.
Oh, I see.
And you know what? The Cureus review reminds us why we give antibiotics before some dental procedures.
Oh, right. To prevent infective endocarditis.
Exactly. A serious heart condition caused by bacteria entering the bloodstream.
Wow. Okay, so even something as routine as a dental cleaning could pose a risk if there's underlying periodontal disease.
It's a good reminder that the mouth is not isolated from the rest of the body.
Right.
Everything is connected.
Okay, so that's one pathway, bacteria sneaking into the bloodstream. What's the other way this mouth-heart connection plays out?
Well, it's all about inflammation, and not just localized inflammation in the gums,
Right.
but systemic inflammation, meaning it affects the whole body.
So it's not just the bacteria themselves causing trouble,
Right.
but the body's response to them.
Exactly. And this is where things get really interesting, especially for us as clinicians,
Okay, I'm listening.
The Cureus study points to specific inflammatory markers like C-reactive protein, or CRP.
Okay, CRP.
Yeah, and these markers are elevated in both periodontal disease and cardiovascular disease.
Wait a minute. So you're saying if I see elevated CRP in a patient's blood work, it could be a sign of inflammation stemming from their mouth.
It's a huge potential clue.
But that changes things.
It's like your body is sending up a flare saying, hey, there's inflammation somewhere.
Right.
And we need to figure out where it's coming from.
Wow, this is blowing my mind. I'm starting to see how neglecting oral health could have much broader implications than we previously thought.
It's a paradigm shift for sure.
It really is.
And we're just scratching the surface because it's not just any bacteria causing this mayhem.
Right.
The article from Oxidative Medicine and Cellular Longevity names some specific culprits.
Oh, lay it on me.
Okay, so we got Porphyromonas, Gingivalis tannerella, Forsythia treponema denticola.
Not exactly names you'd want to invite to a dinner party.
Definitely not. But here's where it gets really intriguing.
Okay, tell me more.
Both the Cureus and the OMCL articles point out that these bacteria or their DNA have been found in atheromatic plaques.
You're kidding me. So these bacteria aren't just hanging out in the mouth, they're traveling to the heart and causing problems there.
It's pretty compelling evidence that they might be playing a direct role in atherosclerosis, the buildup of plaque in the arteries.
Wow.
And that brings us to another piece of this intricate puzzle. Toll-like receptors, or TLRs.
TLRs, those sound familiar. Refresh my memory.
Sure, so they're part of your immune system, like little sentinels guarding against invaders.
Okay.
And when TLRs detect pathogens like those nasty bacteria we talked about, they trigger inflammation to fight them off.
Okay, that makes sense. But what does that have to do with this mouth-heart connection we're talking about?
Well, think about it in chronic periodontal disease. The TLRs are constantly bombarded by bacteria, sending the immune system into overdrive. This chronic low-grade inflammation doesn't just stay in the mouth, it can spill over and affect the entire body, including the cardiovascular system.
So it's like having a car alarm that's always going off. Eventually becomes more of a nuisance than a helpful warning.
Exactly. And that constant inflammatory noise can contribute to the development of atherosclerosis, increasing the risk of heart attack, stroke, and other cardiovascular problems.
Wow, I never thought about it that way.
Yeah.
So we've got bacteria sneaking into the bloodstream, systemic inflammation, and these TLRs going haywire. It's all starting to connect.
It's a complex interplay of factors, but the message is clear.
Okay.
Oral health is not just about a pretty smile.
Right.
It's about overall health, especially cardiovascular health.
This is a game changer for how we approach patient care. So how do we translate this knowledge into actionable steps? What can we as healthcare providers do differently, knowing what we now know about this mouth-heart connection?
Well, that's where it gets really exciting.
Ooh, a cliffhanger. I guess we'll have to wait for part 2 to find out. Stay tuned, everyone. Okay, so we're back, ready to dive into part 2 of this fascinating discussion about this link between periodontal disease and cardiovascular health. But the big question is now, what?
Yeah, where do we go from here?
How do we as healthcare providers actually use this knowledge to improve patient care?
I think it all starts with a shift in mindset.
Okay.
We need to start viewing oral health as a vital sign,
Oh, interesting.
just like blood pressure or heart rate.
Okay, I like that treating oral health as a crucial piece of the whole body picture. So how do we put that into practice?
Well, for starters, a thorough medical history should always include a detailed assessment of oral health.
Right, not just asking if they brush and floss.
Exactly. Dig deeper.
What kind of questions should we be asking?
Ask about their oral hygiene habits, of course, but also ask about any history of periodontal disease, bleeding gums, loose teeth,
Okay.
recent dental procedures, even tooth loss.
Ah,
You'd be surprised how much valuable information you can uncover just by asking.
So it's about being proactive and recognizing those subtle signs that might otherwise be missed.
Absolutely. You know, for example, if a patient mentions bleeding gums, that's a red flag. It's a sign of inflammation and a possible early stage of periodontal disease.
It's like that canary in the coal mine. A seemingly minor symptom could be a warning sign of a much bigger problem brewing beneath the surface.
Exactly. And that's where collaboration with dental professionals becomes absolutely crucial.
Right.
If you see any signs of periodontal disease, don't hesitate to refer the patient to a dentist or periodontist.
It's about creating a more integrated approach to patient care.
Exactly.
Working as a team to connect the dots between oral health and overall health.
That's the goal. And it's not just about referrals.
Right.
Sharing information between medical and dental providers is essential for comprehensive patient management.
I agree.
We need to be communicating with each other, sharing patient histories and treatment plans.
For example, let's say a patient comes to me with high blood pressure and mentions they haven't seen a dentist in years, knowing what we now know about this mouth-heart connection.
Yeah,
I'd be much more proactive at recommending a dental checkup.
exactly. And on the flip side, dentists who see patients with severe periodontal disease should be aware of the potential cardiovascular risks and communicate that information to the patient's primary care physician.
So it's like we're all pieces of the same puzzle, and we need to work together to see the complete picture. Makes you wonder if we should be screening for periodontal disease as part of routine cardiovascular checkups.
That's a great point, and it's something many experts are advocating for.
Interesting.
Early detection and treatment of periodontal disease could potentially reduce the risk of developing cardiovascular disease or experiencing a cardiovascular event.
It makes sense we manage other risk factors like cholesterol and blood pressure, so why not periodontal disease?
Exactly. And the good news is periodontal disease is often preventable and treatable, especially in its early stages.
Which brings us back to the basics. Good oral hygiene,
Right.
brushing, flossing, regular dental checkups.
Absolutely.
It's simple, but incredibly powerful.
We need to educate our patients about the importance of oral hygiene, emphasizing that it's not just about aesthetics. It's a crucial part of their overall health, and it could potentially save their lives.
Absolutely. And beyond, brushing and flossing, regular dental checkups and professional cleanings are essential for catching problems early and preventing them from escalating.
Right. And we also need to consider the role of lifestyle factors.
Oh, yeah.
Things like smoking diet and stress management all impact both oral and cardiovascular health.
So it's about taking a holistic approach to patient care.
Exactly.
Considering all these interconnected factors.
Precisely. And while the research is compelling, we do need to acknowledge that there are confounding factors at play.
Yeah, of course.
Age, sex, genetics, smoking, other health conditions. These can all influence the development of both periodontal disease and cardiovascular disease.
So more research is needed to definitively say that periodontal disease alone causes cardiovascular disease.
Right.
But even with those confounding factors, the evidence is strong enough for us to take this connection seriously and adjust our practices accordingly.
Absolutely. It's about recognizing that the mouth is not isolated from the rest of the body. Right.
What happens in the mouth can have far-reaching consequences.
And vice versa, right?
Exactly.
Systemic conditions can also manifest in the mouth.
Exactly. The Cureus review mentions that certain systemic diseases like diabetes can increase the risk and severity of periodontal disease.
So it's a two-way street. The mouth can be a window into the overall health of the body.
Precisely. And it begs the question, what other connections have we yet to uncover?
Ooh.
How else are our seemingly separate body systems intertwined?
Those are some thought-provoking questions, and I think that's a perfect note to end on. This has been an incredibly insightful deep dive, and I know I'll be approaching patient care differently from now on.
I hope our listeners will too.
Yeah.
You know, we need to move beyond the old adage of brushing and flossing.
Yeah.
And start thinking about oral health as a vital piece of the cardiovascular puzzle. Couldn't have said it better myself. And for our listeners, if you'd like to dive deeper into the research we discussed today, you can find more information about the sources in the description below. And don't forget to schedule those dental checkups. Your heart will thank you for it.
Until next time, stay curious, stay informed, and keep diving deep.
You know, we've covered a lot of ground already.
We have.
But there's one more piece of this puzzle I want to explore before we wrap up.
Okay, what's that?
We've talked about the importance of collaboration between medical and dental providers.
Right.
But what about the role of medications?
Oh, that's a great point. And it's often overlooked, you know.
Really?
Certain medications can actually worsen periodontal disease.
I had no idea. Like, what kinds of medications are we talking about?
While some common culprits are certain antihypertensives, antidepressants, even some oral contraceptives.
Okay, so those are pretty common medications.
They are, and these medications can cause dry mouth, which reduces saliva production.
And saliva is important because...
Well, saliva is actually your mouth's first line of defense. Okay. It helps wash away food debris and bacteria. Right. When saliva production is reduced, you're at a much higher risk of plaque buildup and inflammation, which can worsen periodontal disease.
I see. So it's like creating a perfect storm for those harmful bacteria to thrive.
Exactly. So it's crucial to be aware of these potential side effects and counsel our patients accordingly.
What can we do to mitigate these effects?
Well, we might need to recommend saliva substitutes, encourage more frequent water intake, or even consider alternative medications if the side effects are severe and impacting oral health.
Right. It's about finding that delicate balance between managing the underlying condition and minimizing the impact on oral health.
Absolutely.
It's like a domino effect.
Right.
You know, one medication can impact another system in a way we might not have anticipated.
It really highlights the need for open communication with our patients.
I agree.
They need to feel comfortable reporting any changes they notice in their oral health, especially if they've recently started a new medication.
This whole conversation has really underscored the importance of a paradigm shift.
Yeah,
You know,
it really has.
we need to start viewing oral health as an integral part of overall health, not just a separate entity.
Couldn't agree more. The mouth is not isolated from the rest of the body. What happens in the mouth can have ripple effects throughout the entire system, especially the cardiovascular system.
We've definitely seen that playing out in the research we've discussed today. Those studies from Cureus Vascular Health and risk management and oxidative medicine and cellular longevity all point to this intricate connection between oral health and heart health.
And it goes both ways.
Right.
Systemic conditions can manifest in the mouth as well. For instance, the Cureus review mentions how diabetes can increase the risk and severity of periodontal disease.
So it's a two-way street. The mouth can be a window into the overall health of the body.
Exactly. And it begs the question, what other connections have we yet to uncover?
Huh.
How else are our seemingly separate body systems intertwined?
Those are some thought-provoking questions.
Oh.
And I think that's a perfect note to end on. This has been an incredibly insightful deep dive.
It really has.
And I know we'll be approaching patient care differently from now on.
I hope our listeners will too. We need to move beyond the old adage of brushing and flossing.
Yes.
Start thinking about oral health as a vital piece of the cardiovascular puzzle.
Absolutely. For our listeners, if you'd like to dive deeper into the research we discussed today, you can find more information about those sources in the description below.
And don't forget to schedule those dental checkups.
Right, your heart will thank you for it.
Until next time, stay curious, stay informed, and keep diving deep.